Hey, dudes and dudettes, it's me, your Uncle Herbie, and this is another edition of Wisdom After the Fall. Healthcare costs, I don't have to tell you, in the United States are out of control, and the solution being offered by the retarded left is Medicare for all. This is their idea because senior citizens like me love Medicare, and they think, well, it's so good, let's just give it to everybody and we'll pay for it by simply taxing the rich, which, by the way, that I'm not even going to go into that because there just isn't enough money. The rich, if we took all of their money, would pay for Medicare at his current levels, let alone for everybody else, for about 6 months before they were completely impoverished, including the $1 trillion that Elon Musk has, and then we'd have millions of unemployed people. That is the stupidest part of it. But I'm not even going to go there because it's so dumb and the math is so wrong that unless you're a retard, you already know that. So just pretending that we can print it up out of thin air, watch yesterday's video, will simply undermine the dollar. So that's not going to happen. Healthcare costs since Medicare, if you take a look at this chart, you'll see that from 1960 until about 1970, there was a gentle rise in the cost of healthcare. And that's mostly attributable to better healthcare because science was advancing and new treatments were coming online. They were a little more expensive at first. They would have gotten cheaper in time, as all things are generally supposed to do. But then Medicare was invented. Medicare in 1965 was brought about by Lyndon Johnson, who to me is the embodiment of a modern Greek tragedy, a man who meant well in so many ways and instituted a war on poverty, a war that cannot be won because, as Jesus said, the poor will always be with us. Well-intentioned, but the road to hell is paved with good intentions. And he also decided to address a problem we had in healthcare, which is senior citizens, because as you get older, you get sicker, couldn't afford to buy good health insurance. And people with pre-existing conditions of every age couldn't afford to buy health insurance. And so Medicare was invented for them. Okay, for us, now that I'm a senior citizen. And it was very popular from the start because it's heavily subsidized and people don't pay very much. The Part B premium today is negligible compared to what you guys pay. I pay less for a year in a month than a 20-year-old for my Medicare Part B, and I pay nothing for Medicare Part A, which is the hospital part. B is the doctor's part. And it's a terrific program for the cost, and everybody would love it if we covered them. Of course, it would bankrupt the country. Because when you see what Medicare has done to healthcare costs, look from 1970 onward on the chart, and you will see that it just exploded because Medicare eliminated so many things that controlled healthcare costs. And it added so many things that added to healthcare costs, and it turned into a nightmare. Now, the other thing it did is it eliminated who wanted to insure anybody, because as the states looked at Medicare and how popular it was with senior citizens who were a very reliable voting bloc, they decided, let's expand it and make everybody's coverage have to resemble Medicare. A deductible, a short 80-20, then 100% thereafter, and so on and so forth. And predictably, it exploded healthcare costs, but it also got rid of insurance options. So instead of lots of different insurance companies to go out and shop plans with, now, state by state, there were only a few. We went from thousands to a few. And that was, again, thanks to Medicare. So it would be as if you go to the grocery store today to buy beer and there are thousands of brands, but if we had a national beer program, there would be 3. Okay, you go into the store and there would be Pilsner and maybe one Hefeweizen. I don't even know if they'd have a Hefeweizen. That's probably too fancy, but you're getting the drift. Bureaucrats don't create interesting products, and bureaucrats have no incentive to create interesting options, so they don't. So we imposed this one-size-fit-all thing that everybody had to copy, which drove all these small and medium-sized and lots of large insurance companies that used to provide health insurance just said, the heck with it. We don't want to provide it anymore. We'll stick with our core businesses where we don't have to deal with government regulation. And it imposed enormous costs on doctors. Doctors have to employ people. There are over 50,000 diagnostic codes. And then there are additional codes on top of that of treatments to be applied to the diagnostic codes, none of which a doctor can keep track of. So they have to hire a staff of administrators in their offices, which translates into cost as well. And this is how costs have spiraled out of control, and why this entire program is out of control, and it's only getting worse. And asking for like a reform of it is insane when there's a clean, separate option. Now, let's also talk about what this would cost, because guys, free ain't free. It's got to be paid for through taxes. So let's take a look at a country that has national health insurance, and take a look at what they pay in taxes versus what the same person in the United States living in California would pay in taxes, are paying in taxes today, not after expanded Medicare, right now, this instant. Okay. In Sweden, take a look at the chart. They're annihilated. They make over $15,000 less take home pay a year than you do if you live in California, and much less than you do if you live in states. I picked California because it's the highest tax state along with New York and New Jersey. Okay. If you live in one of those three states, you're still way ahead of the Swedes. Imagine what your tax bill would be if we instituted Medicare for all, because it's got to be paid for. We can't, our $40 trillion deficit doesn't allow anything else. And again, I say it before and I'll say it again, there just aren't enough billionaires and trillionaires and even serious millionaires to pay for this, because most of the wealth in the United States resides in the hands of the middle class. The bottom 50% of wage earners, of the total of about $184 trillion in total U.S. wealth in the hands of U.S. citizens, about $4 trillion of it is held by people below in the lowest half, I should say, who earn less than $75,000 a year, and another $8 billion are in the hands of the billionaires and our sole trillionaire. And everything else, the other 160 some odd trillion dollars, is in our hands, yours and mine. Well, I don't earn more than $75,000, but if you do, it's in your hands. Stocks, bonds, the home you own, so on, mostly real estate, the home you own, and all of that, okay, would be subject to an enormous. We'd have to tax you. There's just no other way to do it. There's not enough money to run the program without it. The politicians, they'll look you right in the eye and lie, or they're just idiots. Okay, they'll look and say, well, this will really save money. And then they just kind of do what a toddler does if you start talking about these facts and stick their fingers in there and go, blah, 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 blah. They don't want to hear it. They don't want to discuss it. But objective reality is objective reality. And if we instituted any kind of single payer system in this country, your tax bill would be worse than the Swedes, because not only would we have to pay for it, but we're not Swedes. Okay, take a look at life expectancies in the United States, okay, versus the rest of the world. Now, it's often said that our life expectancies is shorter than countries that have national health care, and that's true. But that's not because they have national health care and we don't. It's because we're fat. Okay, our obesity rate is higher than anybody else's, which has nothing to do with national health care. It has to do with the food we eat, which is, God forbid the government turns into food Nazis, but it accounts for a large part of our cardiovascular disease, which is our number one killer outside of accidents. And speaking of accidents, the United States is a huge country, and we all have cars. For example, most Europeans, if they have a car, don't drive very much. And for example, using Sweden again as an example of a country with relatively good national health care, it's a small country compared to the United States. It's teeny, with a population of 9 million people, not 340 million. And so they just don't travel nearly as much, and they don't travel by car. So traffic deaths, which kill tens of thousands of Americans every year, just don't happen the same in European countries, okay? Then we come to Black America. There are unique risk factors to the urban Black population in this country, Black on Black violence in particular, that causes a lot of deaths statistically that simply don't take place in countries without that population. Again, I'm not picking on Black people. I'm just saying we have a unique urban Black violence problem that heavily affects our life expectancy statistics. Remember, figures lie and liars figure. And so they'll make it sound like we're dying sooner because they want to prove their point, but there are lots of mitigating factors, okay? That brings me to suicide and gun violence, okay? Guns are easy for suicide, and we have a much higher gun violence and gun suicide rate. Now, we have lots of benefits, and I'm a Second Amendment guy, but don't kid yourself, guys on the right. Gun violence is a factor, and gun deaths are a factor that simply don't take place in these countries. But again, we can have that debate on another day over the Second Amendment, but it affects our life expectancy statistics, okay? So the bottom line is this, okay? Japanese Americans live longer than Japanese. Norwegian Americans live about the same amount of time as Norwegians. Swedish Americans live the same amount of time as Swedes, okay? The point I'm making is Chinese Americans live much longer than Chinese do in China, much longer, by the way, substantially. And African Americans, our most damaged group, live twice as long as actual Africans, okay? Again, because we have better everything. Then Africa is a unique case in and of itself. It's basically sub-Saharan Africa is, and I don't know any other way to say this, it's a shithole from top to bottom of mismanagement, with a few bright spots that are trying to emerge, and we'll see what happens. But the bottom line I'm trying to tell you is we live just as long as anybody else when you take out the fact that we eat too much McDonald's, we shoot each other, we die in traffic accidents. Drug overdoses are a much bigger problem in the United States, thanks to our idiotic drug laws, which I've spoken to before and I will speak to again. But I'm just telling you, the bottom line is we don't live any less than anybody else, and our healthcare is actually much better because in a single payer system, the only way there is to control costs is rationing. Rationing shows up as waiting periods. I'll tell you a story that I've told before, but I'll tell it again. Years ago, I dated a Canadian girl, beautiful woman. And we were, I wouldn't say we ever got serious, but we dated a long time off and on, the distance thing. They say there's an old saying about long distance relationships. They say that the old people tell you, they say that separation makes the heart grow fonder. They never read the second line of that poem, which is, oh, but 'tis not true. It just isn't true. Long distance relationships don't work. So my long distance relationship with this French Canadian girl who lived in Montreal was exciting for a while. I would fly to Montreal and hang out with her and she would come down and back and forth. But anyway, that's not why I'm telling you the story. I'm telling you the story because she had a disease called ankylosing spondylitis. Ankylosing spondylitis, this is years ago. This is something that affects young women, generally under 30, and it's a form of rheumatoid arthritis. And if it's not treated by a drug called Enbrel, okay, before they're 30, they will go blind, okay? In Canada, at the time, Enbrel was simply not available, okay? So they basically told her, they gave her Vioxx, which is an anti-inflammatory for the arthritis, and told her good luck. They control their healthcare costs by either declining coverage, excluding coverage, or simply making waiting periods very long. So for example, just as a slight digression on the same theme, I have 2 artificial shoulders. I had them done as soon as I needed them. If I needed them in Canada, I would be waiting approximately 3 years per shoulder. And I cannot tell you how excruciatingly painful that my shoulders were before they were corrected, okay, at the Mayo Clinic. And speaking of the Mayo Clinic treats over 10,000 foreign patients a year from Scandinavian and European countries who fly to the United States to get treatment because they'd rather not die or suffer during waiting periods. Just saying. And that's just Mayo Clinic. That's not including Johns Hopkins and Mass General and all the other fine hospitals in this country that attract patients from all over the world to come here, because let's not throw out the baby with the bathwater. We actually have the best healthcare in the world with what little is left of American competition. We can make it better, but, it is what it is. Now, what could we do? Let's recognize that healthcare costs are out of control, and let's also recognize that Medicare is what made it go out of control. Medicare became the template. That template was imposed on all insurers. All insurers began to adopt Medicare's diagnostic codes and administrative procedures, plus the entire Department of Health and Human Services was essentially created to administer this giant clusterfuck of a program. It's gotten bigger and more pervasive, and we don't begin to charge seniors what it really costs to insure them, because that's the whole point of the program, let alone pre-existing conditions people, and it's spiraled out of control, and making it bigger will simply destroy the country. It's as simple as that. We can't, watch yesterday's video on retardonomics and inflation and what causes it and why it happens. So what could we have done instead? And the answer is, and I made a chart about this, we could have just done a voucher system. I'm not a cold bastard, okay? It's not that I don't recognize that lots of seniors, including myself, could not possibly afford to buy health insurance on our own. And it's not that I don't recognize that people are born with chronic conditions like, for example, juvenile diabetes, spina bifida, muscular dystrophy, cancers, all kinds of disorders and chronic conditions that make people essentially uninsurable for those conditions. That's the pre-existing condition thing. We could give those people vouchers too at every age, and it would have cost half of what Medicare cost. And we would be in a market environment where there would be much more competition, because what the voucher does, instead of having this big bureaucracy telling doctors how to practice medicine and how to run their practices and what they have to bill, and I'm not even getting into lawyers and lawsuits and the restrictions the American Medical Association puts on the supply of doctors and nurses, which, by the way, the AMA should be destroyed. And that's another problem. It's just as a side note, we'd have a lot cheaper healthcare if we had a lot more doctors. And doctors are a cartel, a political cartel, You think APAC is powerful. The doctors are plenty powerful because they got plenty of money. And they restrict the supply of doctors through the AMA, the American Medical Association, which if that didn't exist, we'd have a lot more doctors. Where's it written you have to be an A+ student or the son of a doctor to practice medicine? I don't see that connection. Okay, but that's, of course, they'll say this is why we have great doctors. This, of course, is bullshit. There are great doctors in Italy and there are great doctors in Norway, despite their systems, and they didn't have to go through the hoops or the American Medical Association things. It's nonsense. So we could increase the supply of doctors, increase the supply of insurance companies, increase the options, and give everyone better options. And then people who couldn't afford it or had pre-existing conditions, regardless of income level, because it's not their fault, would be given a voucher that they could go to any private insurance company and redeem the voucher. And the vouchers for seniors would be on a sliding scale, by the way. We have to means test them. I'm sorry, seniors. The word entitlement should be stricken from the English language. And that means simply based on income. And the way I did it in this chart was I said, if you were below poverty level, you get a voucher for 100%. If you're 25% above poverty level, you get a voucher for 75%. If you're 50% above poverty level, 50%, and so on. Okay, down to zero if you have $1 million in assets and an income over $100,000, because then you can go out and buy high deductible insurance and pay for the deductibles out of your own pocket because you're wealthy. And I know that a lot of seniors are screaming right now, about me talking about taking away Medicare, and that's exactly what I'm saying, because the jig is up, my friends. We have to talk like grown-ups and not like infants, and stop talking in retardonomics. It doesn't work. We can't. If you had a carpenter that came to your house and you had to build an addition and the addition fell down, would you hire him back to fix it and do it again? Well, that's the same idea as taking Medicare, which has destroyed healthcare in this country, and then making it do it again. Okay, let's make it bigger. Maybe that'll make it better. What kind of retardation? Okay, what kind of stupidity? What kind of venal political calculation do you have to look someone in the eye and tell them this is a possible solution to healthcare when the opposite is true? Get the government out of the way. Let private industry innovate. Kill the government monopoly. Kill the government bureaucracy. Give vouchers to the poor. Give vouchers to the pre-existing conditions. Let them buy their own insurance, and we all live happily ever after. So there you go. Why Medicare for All is idiotic and a viable, workable, really workable. And frankly, I would have it administered at the state level. I would just do revenue sharing with the state. And as states need money to pay out the vouchers, I would just have the federal government revenue share with them. The tax burden would be much lower than it is today because the cost would be half of what Medicare is today. And medical costs, which isn't even reflected in this chart, I was just reflecting in the chart the cost of the system. But the cost of the system would be even less. This overstates the cost of vouchers because the chart does not reflect the savings the doctors would incur and therefore have lower fees because they wouldn't have to hire entire staffs to do their paperwork and to file their claims so they can get paid by Medicare and or the companies that are copying Medicare. Okay, let alone HMOs, HMOs and PPOs are voluntary rationing, folks. You're restricting yourself. Wouldn't you rather be able to go to Mayo Clinic if you felt like it because you have private insurance? You don't have to ask your provider. Wouldn't it be nice if you didn't have to get your basic doctor to refer you to a specialist because it's unnecessary because your insurance company won't require it? This is just a Medicare invention nonsense thing, trying to make you jump through enough hoops that you give up before you actually have to take the care. Another way you can control costs in a single payer system or in a bureaucracy like this is to basically make it so difficult for people to get care that they quit and stop trying to get it. Okay, that's what I'm saying to you. Put healthcare back in private hands. Save the country while we're at it. It will stop. If we did this, if we went to a voucher system instead of Medicare, Medicaid, and replaced the whole thing with a voucher system, my God, the trajectory on U.S. debt would change overnight, and we would be out of the disaster we're in. Of course, we're not going to do it. And the shit is going to hit the fan. And we're probably going to try some idiocy like this because that's the trend of democracy. This is why we should have never allowed ourselves to become a democracy instead of the republic that we once were and no longer are. We're a republic in name only, a rhino, which I realize Republicans say is Republican in name only, but you're all Republicans in name only anyway. All of you people compromise yourselves for power to the point where you lose track of what's actually real and objectively true. Okay? Don't be retarded. Don't believe the retardonomics of the political left or the political right. Use your head. Do a little research. One of the joys of living in a time of AI is that you can do a lot of research if you take the time to do it. Don't believe it because some idiot just told you, okay? Look it up. Ask yourself critical thinking questions. And that's how you will learn that it's all retarded. They're all full of shit. You know what the best thing the government could do is? Go home. I mean, I realize we can't have anarchy, but man, the world would be a better place with a lot less government, wouldn't it? All right. Well, that's all I have for today. Thank you very much for watching. Tune in next time, as they always say. I don't know. I never say that, but I said it this time. I don't know. Anyway, like, subscribe, share, you know, the whole 9 yards, yada, yada, yada. Help me get to 1,000 subscribers so I can actually be monetized and don't have to go out in 112-degree heat and drive ride sharing for addicts to go to methadone treatment, which is what I do now. Anyway, don't feel sorry for me. I'm just being silly today. But I would like it to monetize. So if you could like, subscribe, and share, that would be just so great. Thank you very much. We'll talk to you next time. And until then, this is Uncle Herbie saying peace out.